Depression affects 1 in 4 people in the United States, which means almost every family knows somebody in their family or close by that suffered from depression at least once or twice in their life. It's a very common illness, and yet we don't talk about depression in the same way we talk about diabetes or arthritis or cancer even.
The good news is, in the 40 years that I've been doing this, we have made a lot of progress as a field, but we really haven't done so well in translating what we know could help people into getting help out to people and making it available to people. Part of why we created the Johnson Depression Center was an understanding of this gap between what people needed and what they were actually able to get in the community. And we really thought about the need for a comprehensive center of excellence and kind of created a model for the Johnson Depression Center that's modeled after the National Network of Cancer Centers.
Working in a center of excellence to me is also giving that message to the public that this is something legitimate, this is something we know how to treat, and brings it out in the open and makes it okay to get treatment.
And so you tie that regional center of excellence to a national network of centers doing that kind of work in their own way, in their own region, and then you exponentially grow what's possible.
My mother was bipolar, and she spent a lot of my junior high and high school years. She was back and forth in hospital.
Mental health is family issues, it's multi-generational. It's got family solutions. And so where do the families get treatment? We wanted to take a family approach to this, so we actually built out a family services wing as part of our expansion.
So as part of the family team, we now have 5 child and adolescent trained psychologists and psychiatrists that work as a team. And we treat children who are identified from the outside and referred to us. We also screen children of adults who are getting treatment here. And we offer what we call family mental health checkups, just for parents or grandparents who are concerned since they've had this illness and they might want to see if it's affecting their child or grandchild. I use family therapy, I use what we call cognitive behavioral therapy, and I use mindfulness and yoga. And then as a psychiatrist, I use medication when medication's needed.
I think what's unique about us is our focus on creating solutions for patients and their families and thinking about packaging how we deliver care in a way that's meeting the patient's needs. Integrated care is one of the ways we're repackaging things, delivering care in primary care settings.
Hey Mike, good to see you again.
Hi Jennifer, it's good to see you too.
Telehealth is a wonderful tool for integrated care services. Really, what the video conferencing adds to integrated care is to be able to virtually embed providers in a primary care setting.
So I see that you have Dr. Griffin with you. She's your family practice doctor.
You're trying to do really what the Institute of Medicine would call true patient-centered care, right? Bringing the care to the actual patient's environment. Not only does that arguably, obviously increase access, I'd also argue by at least at some of the time by working with the patient in their environment rather than in your clinic environment, you're getting more information and a wider view of the patient, which allows you to better tailor the treatment and increase the quality of care that you're delivering.
Giving care where it's not available is really one of the things that we're certainly all about that. We're looking to expand into more of the rural areas in Colorado, more of the mountain towns, a lot of the plains areas where there isn't as much specialty care, and we can provide services via telehealth. And we're currently under contract with a group called the Cohen Veterans Network. It's a national contract. And one of the things we really liked about that was the ability to serve the family, not just the veteran, but really the family. And the families are the ones who have been left out a lot of times.
One of the things that we've done is get a collection of people who are really passionate about this work and bring different skills to the work. So it's really multidisciplinary. And I really embrace kind of a team-based approach where there are different people bringing their own perspectives to this. And so it creates a unique culture and a unique atmosphere where it's an exciting place to work.
Something that really makes me proud to work here is that the Johnson Depression Center really makes community programs a focus. One of our biggest ones is our suicide prevention training. On average, there are 117 suicides every single day in the U.S. We also do trainings around just kind of introducing what mental health is, resiliency in teens, trauma, along with self-care as well. What's unique about the Johnson Depression Center is that all of these programs are completely free.
We understand it's personal, and it's personal for peoples at all levels of socioeconomic status. And if you can connect with how personal it is, there is so much of a desire to engage professionals and the community to make things better, because there are so many people who understand this problem. We have a luncheon every year. We have 600 people for lunch of community leaders buying tables and who care about this and care about this topic and love being engaged about it. And I actually think that's something that can happen other places too.